Good morning, good afternoon, and good evening to all, and welcome to the session on managing pandemics during the fourth industrial revolution. I'm Dr. Sylvie Briand, the director of the Epidemic and Pandemic Preparedness and Prevention Department at the World Health Organization. And I'm very happy to have you all here at the PMAC. I'm honored to introduce the speakers of this extremely important session. It's an innovative session because we have decided to use PechaKucha format, which is slightly different from the plenary session usually displayed at the PMAC. However, there will still be a live Q&A session at the end of the presentation, as it is done usually for plenary session. I will start by bringing you the background of our session. In the 70s and the year afterwards, remarkable progress in medicines led to a proclamation of a victory of mankind over microbes. At that time, William H. Stewart, US Surgeon General, said, "It's a time to close the book on the problem of infectious disease." And many experts thought the same way. We were very wrong. Nowadays, with rapidly changing ecology, urbanization, climate change, increased travel and fragile public health system, epidemics will become more frequent, more complex, and harder to prevent and contain. So the risk of epidemic and pandemics is increasing, but so are our capacity to deal with them. The progress in science and medicine brings us a lot of hope for a safer, healthier, and more resilient world, provided we can improve equity and access to countermeasures. Today's session is about managing epidemics and pandemic in this context, full of challenges and opportunities. And we have an esteemed panel of experts to touch on some of the challenges we are facing, as well as the opportunities we can seize. They are here to share their vision and perspective to shape the world we want. You will hear from global health experts speaking across 3 themes with just 10 slides each on their take about managing pandemics during the fourth industrial revolution. The 3 themes are new technologies for response, impact on societies, and last but not least, from science to policy. So without further ado, let's kick off our first themes, new technologies for response. I'm looking forward to hearing our experts' perspective on such important subjects as artificial intelligence for global health, advancement in vaccine development platforms, in genomic sequences and new diagnostic tests for infectious diseases, and also mobile apps for COVID-19 responses. Enjoy.
The COVID-19 pandemic has shown us how digitalization of our societies has changed the way how we find information, but also how we access, how we exchange it, and even how we understand information during emergency. People have really struggled with overwhelming amount of information. They also have struggled with once accurate, but now outdated information, with information overload, and even with just fundamental confusion. And this has really challenged how public health practice can cut through this dynamic of infodemic effects across society, personal lives, professional lives, and encourage health behaviors and adherence to epidemic management interventions. Now, at WHO, we've recognized that we need to innovate. This is to better listen and to also understand in real time the information needs and behaviors of populations. When we understand the concerns, the worries, the questions and information gaps that people have at any one time during the epidemic, then we can design the COVID-19 response and we can provide health services and information that meet people's needs. We can use what we learn from social listening to better match how people are experiencing the emergency at any moment in time. And we match them with the response measures. And this paves the way towards higher adherence to public health and social measures, to public health guidance, to vaccines, and higher demand for health services. And it also increases or maintains trust of populations into the health system and in the response. So WHO has pioneered a more robust social listening platform in the time of COVID-19 to provide actionable insights for 30 pilot countries to both address the pandemic and the infodemic. This platform analyzes millions of public social media and online conversations to help responders understand what topics are occupying people's attention, what questions do they have, what topics are increasingly discussed over time, and also which ones keep resurfacing. Now, with years, WHO innovated in the smart use of technology to generate evidence to design a more effective response and public communication. We're not just innovating, we're also using all of the tools and experience at hand so that we can leapfrog and adapt public health practice for the challenges of the 21st century. We have added listening to what worries and concerns people we serve as a fundamental part of the toolbox of the public health practice and emergency response. Thank you.
Hello, I'm Dan Bausch. I work for FIND, the Global Alliance for Diagnostics in Geneva, Switzerland. I'd like to talk to you today about a new approach to diagnostics that has the potential to change the world. This is my 16-year-old son, Nelson. Nelson recently came down with a respiratory illness and asked a very simple question, "Dad, I want to know what I got and how to get rid of it." Fortunately, Nelson lived in an area of the world where he could find out what he had. He had 2 rapid tests, 1 PCR, and turned out indeed to have COVID. He knew what he had, he knew how to get rid of it, or at least what to do to stay isolated. He's vaccinated and now is feeling fine, and others around him quarantined with no complications. There's been incredible technological advances during this outbreak. We saw the first PCR assay only 64 days after the declaration of the outbreak, the first lateral flow assay 236 days, and now genomic sequencing is something that's available in many parts of the world to monitor variants. However, many people in the world don't have such luck. 50% of patients across low and middle income countries never know what they have. Only 1% of primary care clinics have basic diagnostic capacity, so indeed most people in the world don't know what they have or how to get rid of it. This is a major challenge. In June 2021, the United Kingdom and the G7 countries proposed the 100 Days Mission. This is an ambitious program to develop diagnostics, therapeutics, and vaccines within 100 days of the declaration of a major outbreak. It's really a moonshot in order to change our world. FIND is one of the primary players for the diagnostic component of this, and the first steps are to develop diagnostic libraries for known pathogens and high-priority virus families. It's important to have numerous platforms, so not only PCR and lateral flow, but also newer technologies like CRISPR and biomarkers. It's important to know that we can't go from 0 to 100 miles per hour in such an endeavor. It's important to focus on endemic diseases because only through building that sort of capacity, through approaching diseases that affect people on a day-to-day basis, will governments and patients invest in the technology to move forward. Of course, we have to know what's going on and to have surveillance systems. The International Pathogen Surveillance Network, recently set up by the WHO hub in Berlin, is one endeavor, and there's talk now about a new pandemic treaty or convention to require countries to report in timely fashion. It will take a sea change in manufacturing to really come through with the 100 Days Mission. We need to have distributed manufacturing across the world and not rely only on pipelines that come from high-income countries. equally important are regulatory reciprocities in order to allow rapid implementation. But most important is the concept of equity. All the surveillance and great technological tools in the world don't help if a person doesn't have access to care. If you're not seen by a healthcare worker, you don't get diagnosed, you don't know what you have and what to do about it. Thanks very much for listening.
My name is Melanie Saville. I lead vaccine research and development for CEPI, an organisation set up following the Ebola crisis in West Africa, with a goal to helping the world be better prepared for epidemics and pandemics in the future. We were already working on accelerating vaccine development when COVID-19 hit and we knew we needed to act. With just 581 cases, we announced our first 3 partnership agreements on the 23rd of January 2020. We built one of the world's largest and most diverse portfolios of vaccine, built on speed of development, scale of manufacturing, and access to vaccines through COVAX. Our partners, Moderna, AstraZeneca, and Novavax, have licensed vaccines being rolled out in hundreds of millions and billions of doses. Platform technology has played a key role in the pandemic. However, we need to do much better in the future. And CEPI has laid out an ambitious 5-year plan focusing on 3 key challenges. Challenge number 1. How do we prepare for future coronavirus threats? There have already been in the 21st century 3 highly impactful epidemics or pandemics. We must develop broadly protective coronavirus approaches to prepare for the next coronavirus outbreak. Challenge number 2. How do we prepare for disease X? There are many, many viruses from 25 virus families that could be the next epidemic or pandemic. By developing virus family vaccine libraries, we can use libraries to rapidly develop new vaccines. Challenge number 3, how can we get to development of a vaccine in 100 days? Just over 300 days for vaccine development in COVID-19 was extraordinary. But what if we could get to 100 days when there are only 2 million cases as opposed to 68 million cases? We have done an inventory of innovations through COVID-19, and there are many areas where we can improve to get towards that ambitious goal. So our goals are very ambitious, and 2 years ago probably would have been considered as utopian, but we must do better. Millions of lives have been lost, and trillions of dollars lost to the global economy. With CEPI and our $3.5 billion funding ask, we would like to partner with you, with your best technologies and innovations, to break pandemics for the future. We have the tools. We know what we need to do. We are on a mission. Please come and join us. Thank you.
Good morning, good afternoon, good evening. I'm Shan Xu from China Academy of Information and Telecommunication Technology. Many thanks for having me in such an important event to discuss managing pandemics during the Fourth Industrial Revolution. We are on the cusp of the Fourth Industrial Revolution. If you look at human evolution, it took us a few million years to evolve into us as we are now. The Fourth Industrial Revolution is totally a new chapter. It represents a fundamental change in the way we live, work, and relate to one another with intelligence and automation. What if we add wings to this dream? Germ is the epitome of this imagination. So what can we do with germs to manage pandemics and have germ to support the COVID response? I believe you have more or less heard about the 10-day construction hospital in Wuhan. This is a photo taken by a camera germ. To make this 10-day a miracle possible, there are many behind stories to share. For example, 6 germs was used to support the illumination. Compared with the traditional solution, germs can be deployed with 3 minutes, rise to about 50 meters high, covering a lightning range of 6,000 square meters for 10 hours, greatly speed up the construction progress at night. And also, a disinfection germs at the public transportation station. Germs can carry about 11 liters of disinfect at a time, which can cover more than 7,000 square meters for disinfection, reaching higher efficiency, and more important, it is a contactless work. Another story happened in Bayangdian village. A ferry channel was closed during the outbreak. Instead of taking 6 hours by car to deliver daily necessaries to the village across the river, germs can be used by the delivery company to send parcels in 10 minutes successfully. So Bayangdian may be a special case because of its terrain, but most communities can benefit from the modern ways of risk communication by germs and speaker. This is a volunteer that uses germs to remind an elderly citizens the importance of wearing masks. And also an interesting trial is that equipped with several imaging cameras, germs are ready to remotely measure your body temperature while you're standing at your balcony during the quarantine period. So what is the future of germs? More intelligent, more automated, more possibilities for innovation. Yes, for sure. But how can we confirm this is the future that we want? Well, I think have this high-tech people-oriented and find a balance between human and robots may be one direction. And I wonder, what is your answer? Thank you.
Hi everybody, this is Yosuke Tanaka from Japan. I will talk about the lessons we learned from the large cluster incident that happened in Diamond Princess cruise in February of 2020 and what we created afterwards. The Diamond Princess, they had around 4,000 people on board, and a vast amount of people were separated in each rooms. That made the communication and management of all the people very, very difficult, as you can imagine. And the challenge we face were to gather information of the people on board, especially the crew list, passenger list, and the international passengers whose medication prescribed in different countries were very tough, and tracking vast amount of test results are also hard. After the Diamond Princess, the government set up a health monitoring center for overseas entrants that manages all the quarantine information and communications of the entrants coming to Japan every day. A lot of people. For that purpose, the health monitoring center distributed an app called MySOS to be connected and manage all entrants. Entrants can install the app through iOS and under market, so anywhere from the world. Through the 10 to 14 days quarantine time, you are asked to report your health conditions and your current location with GPS data several times a day via MySOS app. You can also upload your test results while in the quarantine time. Also, the operator can give entrants a video call. Because we manage 30 to 40,000 people a day, but having them stay inside home or hotel is crucial but difficult. So we developed an AI to call and check if they are inside the building or not several times a day. Through Diamond Princess incident to manage all these huge entrants, We should ask ourselves what is needed to reopen such large number of crew and passengers cruising, but at the same time with enough infectious control if a known virus cluster happens on board. My idea is to ask all international cruise travelers to use a common app like MySOS before entering countries so that authorities would not suffer what Japan has encountered on Diamond Princess. Today, I share with you what we learned from Diamond Princess. I believe countries with international ports will face exact same struggles, so sharing platform and technologies like MySOS is a key preparation for the future cruise scenes with lots of smiles. Thanks.
Wow, what remarkable perspective. Thank you to Tina, Dan, Melanie, Shan, and Yosuke for starting our session with such illuminating insights. Your work gives us food for thought, and we look forward to keeping up with you all. Moving on, let's address now the second theme of impact on societies. We should never forget that epidemics start in communities and end in communities. Communities are the first to notice when an unusual health event is occurring, and they are essential for the response. This is why we need to listen to communities' concerns and priorities, empower them to respond, in particular, making sure that they have access to the tools and the technologies they need. I'm very eager to learn what our speakers can offer us in this perspective. Enjoy.
Social media is currently dealing with a PR crisis and is being slammed daily for its quote-unquote harm to society. However, the reality is that social media, much like any medical intervention, has both benefits and harms. To speak of only the harms is discounting the tremendous communication advantage the medium holds. With 4 billion logged on social platforms across the world and countless examples of social media influencing everything from politics to commerce to cultural movements, it's time that the medical community shed their biases. What we have here is an underutilized tool to reach billions with valuable evidence-based information to literally save lives. Don't get me wrong, social media certainly has pitfalls. There is no denying the spread and quantity of misinformation has accelerated like never before. Also, the data continues to pour in on its potentially harmful impact on teen mental health, especially for girls. And I don't want to begin to discuss the detrimental effect it's had on our attention spans. Knowing these harms exist and continuing to study the side effects is important and will be an ongoing task. What we can't ignore is the fact that the absence of qualified medical professionals online has led to the proliferation of fearmongers, snake oil salesmen, and conspiracy theorists. Without quality sources, folks are left to fend for themselves. A quick search of the term vaccines or COVID origin will give you an influx of information that makes truth from fantasy indecipherable. The reason for this? The algorithm. It gives people what they want. How does it know what people want? Clicks, shares, or put simply, engagement. The good news here is we can work with instead of against the algorithm. Social media giants like Facebook, Twitter, and YouTube have been open to tweaking their algorithms to slow the spread of predatory disinformation, but it's highly unlikely they will solve the problem all on their own. They are not true publishers and therefore not liable for the information posted. Nor are they medical experts able to distinguish between medical debate and full-on lunacy. We are the medical experts. We are the ones to make a change and fight back against misinformation. I'm a board-certified family medicine physician, and I know what questions my patients have and the language I need to use to make certain that they understand. Now, if only I had a megaphone to get my message out there. Well, social media can be that megaphone. A video goes viral spreading a false rumor that vaccines aren't safe in pregnancy. I act. A fake document starts making its rounds, causing hesitation about the efficacy of masks. I act. How do I act? I tap into the power of social media. I tap into the algorithms of 4 billion people online. How, you may ask? I focus on transparency, honesty, and most important, relatability. I'm transparent about how I've gotten the information. I'm honest about the shortcomings of our knowledge. And I'm relatable because I make content with the viewer in mind. I serve the information exactly as they want to receive it rather than how I think they should receive it. You have the skills, you have the knowledge. Now it's time to stop villainizing social media and instead make it your megaphone. Doctors are nothing without their tools, and tools are nothing without their doctors. So let's add social media to our toolkits, create masterful content, and once and for all, kick misinformation out the door.
Greetings, everyone. So, in the last 2 years, COVID has upended our lives in many different ways. People have been terribly ill, families kept apart for long periods, whole economies damaged, health systems overwhelmed, people having their own unique experiences of it. And it has been an incredibly challenging time for people all over the world. And in the last few months, vaccination has become widely available. And that's a wonderful thing. Here in this image, you can see people lining up for vaccination. And people value vaccination. Most people want vaccines, they know the benefits, and there are plenty of benefits. But we also have threats. Over the last 2 years, we've seen a lot of rumours, misinformation, conspiracy theories, people campaigning against vaccination. And this represents a very small but a noisy minority. Another challenge that we have is that even if people want vaccination, in some settings, access to vaccination services is incredibly difficult. Here's a photo of a son carrying his father for hours to get to a health centre in Brazil. There's an image here too of a health centre in Africa where parents are waiting hours to have their children vaccinated for routine immunisation. So this doesn't make it a pleasant or an easy experience at all. So what drives vaccine uptake? I might be breaking the PechaKucha rules here, but just to explain, based on global evidence and expert input, we've developed this framework showing the 4 behavioural and social drivers of vaccination. So in short, we have thinking and feeling, and that's where we capture attitudes and confidence, social processes, motivation, and practical factors or practical issues. And this is like access or affordability, availability of services, even that experience of getting vaccination, which is so important. Now, if we break down these factors, what are the global trends? Let's just take a look at vaccine willingness or motivations globally for COVID vaccination. This is generally context specific and will vary over time. But if we look at this at a global level over the last year, you can see an increase, and that's really encouraging. But then at the same time, to be able to address these reasons for low uptake, we need to take a closer look locally. And there are 2 main methods that we use for this. Firstly, we can use surveys at a general level to get an overall understanding of the issues, or we can zoom into the details for a richer, in-depth understanding using in-depth interviews or focus groups. And this data is essential to guide our strategies, and that then enables us to learn what really works to be able to close these gaps. But we can't do it alone. And in many places, the communities themselves have the best knowledge about what's needed. And it's really essential to be working together with local community representatives and organisations to equip and empower them and enable them to lead work to find their own solutions. And this is where we can be sharing information, building capacity, establishing partnerships, training advocates, and doing some of that work to connect communities to service providers to really tailor them to their local needs. Sometimes we also need one-to-one dialogue. Often people do have various kinds of questions or concerns about vaccination, particularly if they've been exposed to misinformation, for example. And the best way to respond is through a dialogue with someone who is trusted. What we need to do is to start by listening, being kind, respectful, asking some open questions to fully understand their concerns, and from there, exploring further and eventually sharing accurate information to respond and talking through the reasons why we want to get vaccinated and ultimately to recommend vaccination. Today, vaccines remain one of the most powerful innovations in the history of medicine. We talk about a right to health, and there's a right to vaccines. And as much as we can, we want everyone everywhere to be vaccinated. And to do this, we really need to go local and put people at the heart of our programs and design people-centered or citizen-centered strategies to understand why people are missed, and from there to use that data to guide successful strategies. And it's only then that we'll really be able to build a future for everyone that is much more healthy, safer, and fairer for all. Thank you very much.
Good day, it's a pleasure to be here. I'm going to speak about engaging global networks in emergency preparedness and response. I represent the World Health Organization. Epidemics and pandemics affect individuals, but each individual is part of multiple communities. For example, the community at your workplace, your family community, your friends community, your faith community. Each community influences an individual and the decision that an individual makes during a health emergency. This influence could be obvious and direct, such as your healthcare provider giving you the latest information on COVID-19 vaccination, or the influence could be more complex, such as religious beliefs or concerns that might be raised within your faith community around something like the composition of the vaccines. The EpiWin team believes that the large global networks representing the different communities of work, faith, youth, healthcare are critical partners in emergency preparedness and response, particularly in terms of access to accurate information. Think about, for a moment, the Catholic faith that has approximately 1.3 billion followers globally. That's 17% of the world's population. The Catholic faith does not just have followers attending Mass and a trusted leader. It also has schools, universities, health clinics, development organizations. That is a powerful network. And there's the world of work. Consider global labor union networks, such as the International Trade Union Confederation that represents 200 million workers in 163 countries, impacting every setting. Another powerful global network. What we have sought to understand within the EpiWin team is how can we at WHO, with our mandate, resources, expertise, facilitate the work of these large global networks? How can we strengthen the voice of trusted leaders in their influential positions? How can we listen to these large global networks, feeding back from the communities and individuals that they represent, the concerns, needs, and experiences, and their knowledge in responding to health emergencies within a great diversity of settings? How can we use the convening power of WHO to share knowledge, co-develop and adapt guidance, foster collaboration between different network members? Are there opportunities to guide global advocacy through these networks, particularly around equity and access? In summary, in this highly connected and complicated world, partnerships between WHO and large global networks, particularly in the context of health emergencies, is an impactful, successful, and important initiative that WHO is committed to nurturing.
Hello, my name is Alexandre Pinho, and I'm the Global Lead for the United Nations at Microsoft. 2 years ago, when the pandemic started, I think we all had kind of a similar expression in our faces. Life as we knew it was completely disrupted, and we had to adapt our way of living into something new that simply didn't feel real. With our lives mostly confined to our homes, we rapidly saw on technology kind of a lifeline to reconnect with the world we used to live in, changing gradually into online habits for things like consumption, work, and even social connection with the people we love and we care about. With our lives becoming totally different, we also realized that we were not the only ones at home. Our families were there, and this was forcing us to completely change the way we were living and making it really challenging to conciliate professional and personal life into a single place, forcing us to adapt our homes and family schedules to fit this new reality. While the first perception we had from this change was kind of a negative perspective of the impacts it brought, we also start feeling gradually that there were also positive things, mostly related with the flexibility this new way of living was bringing us to our lives and allowing us to conciliate a lot more effectively our personal and professional needs in a single day. So with our lives becoming a lot more digital, there are, though, a set of principles that we need to make sure we care about in order to make sure that our digital lives and our lives in the digital world become a lot more sustainable and safe going into the future. The first one is related with well-being. Humans were simply not made to spend their lives in front of a computer talking to a screen. Reconnecting with the real world and the people you love and the things you care about is an absolute fundamental thing to preserve your mental and physical health, and something you need to build as a priority. Secondly, the aspects of leadership and culture. Leaders in the world need to understand that people have different expectations on the way they want to live their life. And so the public policies and the corporate policies need to adapt to this new reality, allowing them to live the lives they want. The third piece is related with security and is related with digital trust. Security, privacy, trustworthy information. These are all fundamental principles that we need to uphold as part of the digital community and as digital principles into our life and key fundamental principles. But another one is related with digital inclusion. Not all the populations in the world have the same possibility to access technology the way we do in the developed world, and it's our responsibility to make sure that we create conditions to bridge this digital divide and create similar opportunity. To finish, I would just say that certainly the pandemic brought us a lot of problems and challenges, but it also brought us a lot of opportunities and new possibilities that, if we leverage in the right way together as a global community from private, public, and civil society, can really help us shape a better future.
Fantastic contribution. Many thanks, Dr. Mike, Lisa, Sarah, and Alexander, for providing your unique perspective on the cornerstone of epidemic and pandemic response. I hope you like this PechaKucha presentation format. Though each presenter has distilled their message down to just 10 slides, it is remarkable how much energy and insight each presentation has offered. Let's continue now with our last theme, from science to policy. This is a very important theme for us. We have seen in the past decade the evolution of the role of the science for policy and decision making. While new technology offers unprecedented opportunities to rapidly generate and share knowledge, they also bring new challenges in terms of legitimacy, trust, and security. I'm looking forward to hear what our distinguished speakers can propose to use science at its best to support decision making. Good luck, presenter, and thanks.
Hi, I'm Bola Olayinka, and I'll be speaking about the role of a National Public Health Institute using the Nigeria Center for Disease, the NCDC, as an example. This is a nascent agency that started its activities in 2011 and was enacted by a bill in 2018 to prevent, to detect and respond to infectious threats and public health emergencies. A National Public Health Institute and NPHI needs a sense of direction to guide its activities and its decisions, and also to support a dynamism that is needed to address emerging challenges. Critical to an NPHI's function is the coordination of public health activities. This involves the monitoring and evaluation of public health events. It involves decision making. It involves communication with the people, and also providing guidance for policy makers. Outbreak preparedness is critical in a world where we face emerging and re-emerging diseases, and an NPHI evaluates and assesses the system in the country, the public health system in the country, in terms of its preparedness and readiness to respond to outbreaks. Assessing the health status of the nation is important, and this is done by obtaining information on health indices across the country. Getting the information, evaluating and analyzing it is what surveillance is all about, and this guides programs and policies. Responding to outbreaks is critical and requires a lot of resources. The resources could be for laboratory analysis, for management of cases, for educating the people, and this must get to the places where they are needed. A country like Nigeria that experiences recurrent outbreaks all year round, there's always need for new information, new understandings, new conclusions, and this is brought about by research and scientific development. And the findings from the research and scientific development are translated into guidelines, into protocols, into manuals to help to improve the quality of public health service delivery to the people of the nation. Now, for all these activities to occur and to be sustained, there is need for adequate finances. There must be budgetary provision by the country to a National Public Health Institute to enable it to fulfill its mandate in protecting the health of the people. Finally, we cannot underestimate the role of partnerships, networking, and collaboration, all putting their hands together, working together for effective public health response. Because, of course, we remember that a public health or an infectious threat anywhere is an infectious threat everywhere.
Health security is like a chameleon that changes colors depending on its environment. Likewise, the concept of health security changes as new evidence becomes available. The original concept of health security developed over many centuries, and one of the first accounts is when the city-state of Venice attempted to keep plague out by quarantining ships in the harbor. During the following centuries, the concept remained the same: keep disease out at borders, and this was enshrined in the international health regulations that required certain measures in the aviation and shipping industries, including measures at airports to control disease vectors and various other requirements. The SARS outbreak in 2003 changed all that. A medical doctor who was treating patients in China with an undiagnosed respiratory illness became sick himself and went to a wedding in Hong Kong, and from one night's stay in a hotel passed the infection to persons in adjacent rooms who returned to their own countries. A revision of the international health regulations was completed after this incident, when political leaders had heightened awareness of the silent spread of infectious diseases across international borders. And in the revision, a new requirement was included that each country develop strong public health capacities to detect and respond where and when disease outbreaks occur. A few years later, the Ebola outbreaks occurred in West Africa with a high death toll and severe economic disruption. The response in industrialized countries was again an attempt to stop disease at borders, but at the same time healthcare collapsed in West Africa, with hospitals and health facilities abandoned. This resulted in high mortality for those with Ebola infection, including health workers who were unable to access healthcare themselves. And in addition, children and adults with endemic diseases such as malaria were unable to access healthcare either. The outcome was a high mortality from Ebola, but even higher mortality from malaria, measles, and other diseases. The same failure to access healthcare has occurred in industrialized countries during the current pandemic of COVID-19, when early or on supplemental health facilities, some in Army field hospitals, were required. The graph shows that not only were adults from COVID-19 deaths, but also an excess of deaths that occurred due to non-COVID causes. This adds another dimension to the concept of health security, resilient healthcare. Without resilient health systems, mortality increases both for persons affected by a pandemic, but also others who are unable to access routine health care. A characteristic of COVID-19 is the ability to cause serious illness and death in the elderly, and in those with comorbidities such as diabetes and cardiac disease. Had populations been healthier, in some countries mortality would have been less before life-saving vaccines became available. The third concept of health security is thus healthy populations, and the three interlocking functions that best describe health security today are strong public health, able to detect and respond where and when outbreaks occur, resilient and sustainable access to health care, and healthy populations. This is the message we must make sure our political leaders understand.
Hello. I'm delighted to join you today to share Wellcome's perspective, and I send my thanks to WHO for organising such an interesting set of contributors. Wellcome supports science to solve the urgent health challenges facing everyone, so I'll give you an R&D funder's view of pandemic preparedness. In the pandemic, we've seen some of the best of science. We've harnessed R&D to test and create brilliant tools that, used well, are helping us to manage the pandemic. By now, we all know about the vaccines, including new mRNA technologies, but we've also seen rapid, large-scale clinical trials, like Recovery and Solidarity, that have quickly generated evidence on treatments. And by deploying genomic sequencing at scale around the world, we've been able to identify new variants like Omicron so that we're better prepared to respond. The pandemic has required research funders to act fast, quickly identifying opportunities and often speeding up processes. But we've only been able to switch on at that kind of speed because of previous investment in the system. This success has been built on decades of training, of work and sustained funding for new ideas. This is why fundamental discovery research remains at the heart of Wellcome's work alongside our three health challenges. The job of funders isn't over. We need continued investment for research funders to manage the transition from pandemic to COVID as an endemic disease. And that's going to take more and better tools, not just next generation vaccines and preventative drugs, but also public health and communications tools. That means requiring support for a wide range of disciplines, not just the biomedical sciences. But it's not just the funding that's important, it's also how the wider environment supports R&D. For example, regulation, data sharing and collaboration. Regulatory and ethical frameworks that are risk proportionate and agile, that allow clinical trials and other research to both start quickly and safely. And we have to get these fundamentals right and nurture the wider environment for research, now and in the future. Funders have got a role to play here in the expectations we set for those that we fund, for example, how they share their data, but also advocating for change when the power lies with others. An area that needs urgent attention is revitalising the collaboration and sharing of data, where the global politics of the pandemic have been damaging this core value of research that we must resist. So research funders have played an important role in the pandemic and will continue to do so. But as the Independent Panel on Pandemic Preparedness and Response and the G20 High-Level Independent Panel have said, the pandemic has revealed major gaps in how the world prepares for these events. Our existing funding structures are simply not enough. We need to think about the vaccines, drugs, diagnostics and a global network of real-time surveillance as global public goods, and we need to fund them as such. That means a faster, better funded and more globally coordinated approach. Science has performed well in the circumstances, but we can do much better. This boosted support for science is essential, but we all know that the science alone is not enough, Until we ensure global equitable access to all the tools science has developed, we won't see their full benefit. Until we ensure global equitable access to these tools, we all remain at risk. 2022 has to be the year that we act.
Since the beginning of the 21st century, we are seeing increasing number of large outbreaks and epidemics. To name some, SARS, avian influenza, MERS, yellow fever, cholera, Ebola, Zika, 2009 pandemic influenza, and COVID-19. Explosive population growth, urbanization, increased and accelerated movements of people, environmental degradation, mass production of food, animals, and climate change. All this contribute to growing infectious threats. Each year, about 180 pandemic seed events are reported across the world. COVID-19 pandemic revealed that the world wasn't prepared. In addition to numerous review efforts, we introduced an innovative approach called Foresight. Foresight is not a prediction of the future. It is an act of imagining. We can together spot opportunities, risks, and ways to get around them. There is an action orientation in Foresight, along with creating participatory ownership and consideration of various alternatives. The time horizon was set in the next 5 years to produce immediately actionable recommendations. Foresight requires us to learn into the unknown. It relies heavily on our ability to hear others. We worked together with stakeholders from different fields and sectors across the world, and Foresight professionals, futurists. Yes, there exists a profession called futurist. The futurists supported WHO in identifying key trends and factors shaping the future of pandemic, developing a set of plausible scenarios, and working with expert groups to identify associated risks and implications. Also, public roundtables were held to make sure different views are heard. Scenario planning is an important part of Foresight. The 3 drawings here are just showing you some ideas like happiest end of pandemic, virus variants and vaccine whack-a-mole, or out of frying pan into fire, kind of the worst becoming worse. The futurists developed 4 scenarios, not these 3. Now I'm going to summarize the concluding key messages coming out of the Foresight exercise. Comes first is trust. Traditional authorities are losing trust. Infodemic undermines important message to save lives. How can we build back trust of people? The second pillar of the 3 overarching guiding principles is solidarity and equity. In this interconnected world, no one is safe until everyone's safe. Can we all together extinguish epidemic fire with empathy? The last pillar is sustainable development. Making progress in all fronts of United Nations SDGs will contribute to stronger preparedness. You are invited to watch the videos of the plausible future scenarios, each of them named after a popular song. Stay tuned.
Brilliant. Thank you, Bola, Nikki, David, and Beth for such inspiring viewpoints and for giving our evening such an insightful outlook. I'm now very pleased to give the floor to Dr. Michael Ryan, Executive Director of the WHO Health Emergency Program. And thank you, Mike, for taking the time to give us your views on how to manage epidemics and pandemics in the 21st century.
Good morning, good afternoon, good evening. Will we be ready for the next pandemic? Can we prevent, control and mitigate its impact on health, economies and communities? What role will the 4th Industrial Revolution play in the countdown to a future pandemic? Can we leverage that revolution to innovate, communicate, coordinate and deliver solutions? Can we develop collective foresight and predictive analytics for disease emergence? Can we track biodiversity, biostress, environmental degradation and biosecurity at the animal-human interface? Can we rapidly detect and track disease emergence, amplification, dissemination and impact? It's a huge opportunity for innovation and collaborative intelligence. Local, national and global systems are deeply interconnected. It is up to us whether that connectedness will be our strength or our weakness. Will it generate solidarity versus stigma, listening versus shouting, cooperation versus competition, sharing versus hoarding? Can the fourth industrial revolution provide the tools to listen, inform, innovate and coordinate? Can we develop, test, adapt and stockpile countermeasures before the next pandemic? Will we have rapid, scalable, distributed and agile production and delivery systems? Will distribution be based on need and impact and not on profit and power? Innovation can help us develop better, easier to make, cheaper tools and get them distributed rapidly and efficiently to the front line. We will need a trained, equipped, protected and multidisciplinary health emergency workforce at all levels. Will they be supported with the training and tools they need? We will need innovation in lifelong and remote learning, immersive training, exercises and simulations. We will need to train together if we are to respond together. Preparedness should not be seen as a cost. It is a vital investment in our collective security. Every dollar spent on preparedness and readiness will return massive rewards. Those investments need to be predictable and sustained over many years. The innovation that we need in everything will not be delivered unless we innovate in sustainable financing, exploring novel approaches and financing instruments. Trust takes years to build and minutes to lose. It will be the magic dust of the next pandemic. Trust between governments, between sectors, but most important, trust between communities and their leaders. Trust that is built on transparency, dialogue and empowerment. Trust that counters misinformation without shutting down the conversation. Nowhere is the fourth industrial revolution more important or potentially more destructive. The next pandemic will amplify and exploit health, social and climate inequities. They are intertwined and they must be addressed immediately. We must also fix the inequity in access to information and life-saving interventions and build equity into the fabric of preparedness. Technology can be an equalizer or a divider. It can facilitate or generate obstacles. It's our choice. Even if we are prepared, there will still be pressure, surprises and setbacks. That is why we will need to be agile and adaptable. We will need to have developed muscle memory through scenario-based planning, simulations and exercises. We need networked responses that can tolerate local or system failures. Innovation, technology, training and practice can help us build that resilience. So, will we be ready? Think about it. Will the fourth industrial revolution and technological innovation take us closer or further away from being ready? The question is, will we be?
Thank you so much, Mike, for sharing your experience. I could not have given better words for the conclusion of our session. I would like to thank all our presenters for taking the PechaKucha challenge and distilling their unique perspectives so concisely so that we could hear from many experts in one session. I would also like to thank the PMAC Secretariat for this platform to share and all the contributors who helped to bring together this session on managing pandemic during the fourth industrial revolution. And finally, we would like to thank you, our audience, for being with us tonight or this morning or this afternoon, depending on where you live. We encourage you all to take a deeper dive into those issues and into each presentation. The presentations will be on the WHO website, as well as PechaKucha's and PMAC's website. Please stay tuned. There will be a Q&A session with some of our presenters just now. And thank you to Professor Nikki Shindo for chairing this Q&A session. And until next, I'm Dr. Sylvie Briand, wishing you all a healthy 2022 year and a good day or a good night. Bye-bye.